Good morning everybody, this is Dr. Pavan Rasalkar, Associate Professor of Cardiology, KIMS Hospital, Bangalore. Today we are going to demonstrate the procedure of coronary angiography. Coronary angiography is an invasive procedure wherein the arteries of the heart, called as the coronary arteries, are studied to look for any blockages in them. The coronary arteries arise from the aortic sinus. So we directly reach the aortic sinus either through the radial artery in the wrist or the femoral artery in the groin. And we directly hook the coronary arteries with diagnostic catheters and see if there is any blockage. And for visualization under fluoroscopy, we use something called as contrast agent for opacification of the arteries. So now we will be demonstrating the coronary angiography via the radial route. So we are doing the angiogram from the radial route. The right wrist is exposed. We have painted it with betadine for disinfection. The radial artery is on the lateral side of the wrist, so we palpate that. First step is giving local anesthesia with lignocaine so that the patient feels no or minimal pain during the puncture. After the local anesthesia, we give a break of around 30 seconds to 1 minute for the local anesthesia to act. Then we go ahead with the puncture. Firstly, through the puncture needle, we put in the guide wire. Over the guide wire, we put the radial sheath. Once the sheath is in, the introducer as well as the guide wire are removed. We see if there is a good backflow to confirm the positioning of the sheath into the artery. Then we flush the sheath and give heparin as well as NTG and Dilsem to prevent the spasm of the radial artery. Then we go ahead with the angiogram. The radial angiogram, there is just one catheter, both for the right and left side, called as the tiger catheter. This is the one. So we'll proceed with the angiogram now. So now we have reached the aortic sinus and we will be hooking the coronary arteries. Now I hook the right coronary. Next will be the left coronary artery. So I hook the left. Then we will be taking signals to see if there is presence of any blockage inside the arteries. One view is done, we are going with the other view. Iliocranial followed by iliocaudal. Iliacaudal. So we are done with the coronary angiogram via the radial route. Stop. The femoral approach, here the right groin is exposed and painted with betadine for sterilization. Firstly, we will be palpating the femoral artery and giving local anesthesia over it so that the patient feels minimal pain during the puncture. Then next is the femoral puncture strip. Through the puncture needle, we are introduced a guide wire into the femoral artery, and over the guide wire we put in F sheath, femoral sheath, and rest of all the hardware will reach the heart through this femoral sheath. Blade, sister. Blade. Once the femoral sheath is in, the guide wire and the introducer is removed. We confirm a good backflow, confirm that we are in the femoral artery, and we give 2500 international units of heparin so that there is no clot formation in the sheath or any of the diagnostic catheter during the procedure. So now we will be proceeding with the angiogram. There are two diagnostic catheters for the femoral. For the left side it is JL and for the right side it is JR. We will start with the JL first. This is the JL catheter. It is pre-curved so that once we reach the aortic sinus, it goes and hooks the left main. There is a guide wire inside this. As you can see at the tip, this will help us navigate through the aorta into the aortic sinus. Now we are into the aortic sinus, and hence we removed the guide wire and we connected to the 3-port system which has the pressure lines as well as the contrast region. So now we will hook the left main and proceed with the angiogram, as you can see on the monitor. That's the left main hooked. That's the angiogram of the left coronary system. We take multiple views because sometimes the blockages can be eccentric and it can be vised in one view. LAO cranial. LAO caudal final shot. Let's now get ready with JR. So we have currently done angiogram. We remove the left-sided catheter and put in the specialized right-sided catheter to hook the right coronary system. This is the JR, which will hook the right side of the heart. Now we will be hooking the right coronary artery. Take one wave, RAO. Concentrate on the LAD as well. Long cine. Keep it cranial. Focus on RCA followed by long cine focusing the LAD, which is filling distally. So that's it. You are done with the coronary angiogram via the femoral rotor.